Thank you very much, President. My adjournment matter is around pandemic stress leave, and it's directed to the Premier. The press conference that the Premier held on Sunday, the 3rd of October, put nurses front and centre, and their stories were harrowing, and it sent a strong message about getting vaccinated. Our nurses, our allied health, every healthcare professional, as we know and as we've been speaking about for much of today, is doing it really tough. I had a call from a nurse who had just finished a double shift, had gone home at 3 a.m, was called back to fill another shift. These teams are so stretched. The nurses are covering far more patients than they should be. Those in allied health are being asked to attend situations far beyond their training, and it's scary and it's troubling, and they have been going through it for now 18 months, and they are stressed beyond belief. They are at their wits' end, and they know it's going to get worse before it gets better. These workers certainly need to be paid more, but actually what they need is a break. And it's time for us to show that and give them that break. We must compensate our healthcare workers, but more importantly almost than money, they actually just need a break. So the action that I'm seeking is for the government to create a 2-week pandemic stress leave for all healthcare workers. It might be many months before they're able to take that leave, but it's a much needed holiday, and it shouldn't have to come out of their annual leave. And we're seeing now nurses and other healthcare workers taking sick leave so that they can just get a break because they've had to do so many double shifts, so many extra time. So to the Premier, the action that I seek is that he directs his department to create a policy of pandemic stress leave for those on our front line.
Mr David.